I will try to show you how you get from here to here, first of all. So I will take it a step back from Julia's talk and talk about how we can embed and produce histoimages from different complex in vitro models. Working with different complex in vitro models, we really quickly realized that every single model has its specialty and needs for histoprocessing. So there is not one fits all solution for every single model. So that's why we have developed 5 different high throughput, robust end-to-end workflow for histoprocessing that I would like to briefly introduce you to. So first, to briefly set the context, I would like to highlight how we can make use of the complex in vitro models along the drug discovery value chain. So I think you all are aware that we can use those complex in vitro models for biomarker-driven translation, but also they are really helpful to gain mechanistic insights into emerging clinical toxicities, so really have the back translation. And we are now focusing on the use of the complex in vitro models for histoprocessing, especially in the preclinical tox assessment. So let me quickly show you how preclinical tox assessment is usually done in the pathology context. So how does it work? Usually we have few animals that are treated with a compound, then you harvest those the organs of interest, and you produce an H&E, so an hematoxylin eosine staining of the whole organ in this case, and pathologists can evaluate this image and look if there's a single cell toxicity occurring and where is it occurring, which cell types, and so on and so forth. So bringing this together in the in vitro world, what we envision that you have your in vitro system. In this case, you have some organoids. You produce a lot of organoids usually if your system is capable of doing that. So you end up with thousands of organoids. You can also treat them with compounds. And then you can also, similarly as in the in vivo, you can harvest those organoids and produce an H&E image of an organoid. That's, again, you can give to a pathologist, and he or she can evaluate those images. But still accounting for the huge differences in numbers. You have few animals usually in tox studies, but a lot of organoids when using in vitro systems. So how can we implement this idea in a full workflow? So in future we would like to go a step further and really apply fully automated AI readouts for in vitro pathology to enable and accelerate compound and dose selection, and eventually even incorporate patient tumor heterogeneity. So how do we think it could work? So you have your patient-derived tissue, you produce your organoids, you do your compound testing, and then you have the histoprocessing in place that then can either be evaluated by the pathologist, or if you're lucky enough and have developed such tools, you have AI machine learning components that can predict the dose response, toxicity, or efficacy depending on your question and the algorithms. So today I would like to highlight this pillar, so the histoprocessing that has been adapted for different complex in vitro models, ranging from spheroids, organoids, and also microfluidic chips. So before showing you like all the very fancy details, just a minute to acknowledge the increasing complexity of the models that are on the market and constantly being developed. So we have static models, we have flow models, and I think you cannot even count all of them. But just that you know, like, yeah, there is not a one-fit-all solution, but we did our best. So how do we get from your in vitro system to your H&E images? So it is like a schematic that shows you just to guide you through what you can apply for different techniques. And just as a backup, we started with the models that we already worked in-house at Roche. So we worked with different organoids and spheroids that are already published and out, also with intestinal organs, co-cultured models, and also microvascular on a chip. So really have like a wide range of different systems. So imagine you have your complex in vitro model, then maybe it's either a flow model or a static model. If it's a flow model, you most probably have networks of cells, and then you would go for a lithography method, and here you just see like one example of the AIM chip embedded in agarose. What is here red is like the eosin staining to really make it visible. If you have a static model, you either have what we call 3D microtissue or a co-culture of mobile cells. If this is the latter is the case, you should go for direct and well embedding to really ensure that your mobile cells, the spatial location of those mobile cells are retained, and I will show you an example of it later. If you have 3D microtissues such as organoids or spheroids, you may have either a small sample size for your precious sample, very few conditions, so you would pool all of them to generate an organoid palette and then proceed from here. Or you have a large sample size, many conditions, so you would like to get a droplet to really have it very dense, so have a lot of organoids or spheroids in one droplet. So how does it look like then once they're embedded? So here you see the different workflows that we have developed. You see here on the left-hand side we have cryo embedding, so it means it's very fast. You have 1 hour of approximately even less, 1 hour, so you end and we freeze it away, and then it's very fast. You get very fast the cryo sections of that. And we also have the FFPE embedding, so the formalin fixed, paraffin embedded histotechniques, and what I already explained to you. You have an organoid palette, you embed an agarose, we have direct and well, droplet, or lithography. We call it lithography because you perfuse the vessels with agarose, and then you take out the channel, and then again you put it in agarose, so 2 times embedded, and then the nice morphology of the network is still retained. Before showing you the results of that, let me just give you one example because I think then it's better to illustrate it. So here's just one example of the BB organoids. You grow your organoids in a dish. Here you will end up with 3,000 organoids per 96-well plate because it's a U-shaped multi-plate, and you generate your organoid pellet. Then you embed it in agarose. You take this what you see here in pink again. These are all the organoids because they have been stained before, so you can really visualize them by eye. You take this agarose block into a paraffin block, so you can also have multiple inlets in one block. Then you can even use our automated cutting machine and automated staining machine, so really have a high throughput, have a very fast workflow for that. And then you end up in a high resolution scan, which is also very fast. And you have then multiple BB organoids here on one section, and you really hope you can appreciate the nice retained morphology of this organoid. And this is just grayed out, but eventually you could also do the image analysis on those images. So come back to the different workflows. Here the cryo organoid pellet, what I said, it's very fast, but the morphology is okay-ish, but could be better with the FFPE. But it's very fast, and if you just need to check for several markers, it's really helpful, and it will also already give you like an idea of the morphology of this model. With the FFPEs, you have here the organoid pellet, as I showed you just for a second ago, the nice morphology, the direct and well, as I said. When you have mobile cells co-cultured, that you also would like to retain their spatial location. Here's one example of the intestinal organoids and co-culture of the PBMCs. You really see like those PBMCs are still in the same location as before. The droplet embedding, really, you can really have a lot of organoids in one droplet in one slide. As you see, there are a lot of organoids here in one slide. And then, last but not least, the FFPE from the microvascular on a chip. You really see this one channel of a chip, and here you still have a nice morphology of the network of those cells here. Once we have generated all of those different blocks, and we also have more to come, we started to like, okay, now we have those blocks, and now we can really start like applying the the standard pathology or histopathology methods on those sections. So I will show you like 3 examples, and here's just one example of where we did like a model characterization with immunohistochemistry. And here, this is on a small intestine organoid, and what we basically did here, we stained for markers that are highly relevant for the intestine organoids, for SOX9, which is stem cell marker, but also FABP1 and MUC2, which are intestinal markers, and really looked into the time course. And the human small intestine really helped to determine if the staining is specific. And then we also quantified the different markers here in the organoids. So we really see like a decrease of the stem cell-like properties, but also an increase of the intestine characteristic markers. And this really helped to determine the best day for experiments, which is here in day 5, because on day 7 you see there's a morphological disassembly of the organoids. So it was really helpful for the model characterization. As a second example, and you might have seen this image also in Nicole's talk before, this is really like the one step back. So we developed this method to really see if we can phenotype all those PBMCs that have been co-cultured with this intestine organoid, and you really see that the spatial location of these PBMCs has been retrained. So now it's a time you can start applying compounds and really measure then the moving of those PBMCs towards the organoid and also quantify this. The third example is used in the cryo-sections. So here, what we did here, we used GFP-labeled HD-Max D3 cells, which are brain endothelial cells, a cell line, and they are GFP-labeled. You assemble them in the dish, and then you produce your cryo-sections, and then just screen for the, you apply the GFP channel, and still this label is still retained, even though you have processed your organoids for the histoprocessing. On top of that, we also applied Ki-67 immunofluorescence staining, and what you can hopefully appreciate here, that every single DAPI nucleus has still its original label. Some of them are additionally Ki-60 positive, so some of them are still proliferating, but the point is like every single cell still has its label, so we can really use this for model validation. So with that, I hope I could convince you that really these are like really improved workflows for those histotechniques, and you can expand their use, not only use on those complex immune models, but also on your own model to really assess the efficacy and toxicity in a really robust and sensitive high throughput manner. So I will bring you back to this schematic. So now we have developed those 5 different histotechnique workflows, and this really enables a standard histological evaluation and screen on a single cell level. With a high resolution, we deal here with 40x images for efficacy or toxicity evaluation. And as I showed you with 3 examples, you can use those for model characterization and validation. So what's next? Of course, you can always do more, and you do more further automation and increasing throughput, because especially like the harvesting of the organ, it's manual, but you can also think about automating those steps. And here on the schematic, I'm just reminding you, like you can really choose like the best embedding technique here, depending on your complex in vitro model, on your co-culture, and also experimental layout. And I think in future this will also be a bit improved with more models coming in. So this brings me back to the overview slide. So what we envision is that the toxicologic pathologists could use those standard histology readouts of the complex in vitro models to really identify the important mechanisms of the compounds on those 2D slides. They can quantify its respective impact due to the high resolution, also the high number. And once identified those mechanisms, you can dig deeper, as Julia already mentioned. You can then apply the confocal microscopy, which is more laborious, and also, or lattice light sheet, or and so on and so forth. So really, first you identify, there's a toxicity going on, and then you can dig deeper. And ideally, you can also apply, not to have to somebody sitting there evaluating 3,000 of organoids, but you have the AI machine learning component in place that really can predict the dose response to toxicity or efficacy. So for that, we also did that, this exercise. So for that, we developed an AI algorithm that detects apoptotic and necrotic cells only on an H&E. So you just feed in the H&E and run this algorithm, and you will get the number of apoptotic cells. And we validated this, so if you're interested in how we can put this further, even further on the use case of BB organoids, but surely can expand it also to different other models and other different other questions, you can visit the poster 105. And with that, I think I need to acknowledge the people that are supporting me, also Marius working with the intestine organoids, and my supervisors Nadine and Roberto. So yes, so feel free if you have any burning questions.